it's a real honor to be here before Cheryl speaks. Why I was invited was I was asked to give a little talk on some of the technical needs that are currently in the that licensed producers and licensed dealers within Canada have for the cannabis market. And really, ultimately, what it comes down to is whether you're making a product for sale or not. It's ultimately what it comes down to is you have to test for it, and you have to test for quality, and you have to test for safety. And so, Agilent Technologies is a company that's been long involved with testing in the cannabis market in the United States. We are an early adopter. And just to give you an introduction to the company, this is who we are. We have about 14,000 employees around the world. We're a multinational company. If you look us up on the stock exchange, on the New York Stock Exchange, we're just the letter A. Agilent Technologies was a spin-off of Hewlett-Packard. So we started off as Hewlett-Packard, and then they acquired printers and computers, and then they spun us off as Agilent. So we are really Hewlett-Packard. This is, since this talk is really focused on innovations, I want to show you the investments that we make in innovations. So in the last 3 years, Agilent has invested over $1 billion, $1 billion in just pure R&D to really push the boundaries of what's possible in scientific analysis. And as I had mentioned, this comes from a long history as Hewlett-Packard being formed in 1999. So before I go on and talk a little bit about what we do in the cannabis market, cannabis is something that we are entering into, but where we are really strong are in the test and measurements in both pharma, academia, diagnostic, clinical, food, environmental, chemical, and energy. And so the water that you drink, the food that you eat, we do all the testing to make sure that everything is safe. For pharmaceutical testing, we make sure that all the drugs that are released are safe. And of course, academia and government is a very big client of Agilent. So Agilent was an early mover in supplying laboratory solutions for cannabis. This is just a map, an overview of where medical cannabis and recreational cannabis is legal in the United States. But we were early on when Colorado, California was legalizing cannabis. So we worked with a lot of producers there and testers. And one of the things that we realized is that it's very, very difficult to actually analyze for cannabis because there is a wide diversity of matrices, from edibles, oils, to plants. And so there are a lot of challenges in analyzing for cannabis. And so cannabis is a very complex botanical. It has 66 known cannabinoids, 128 known terpenes, flavonoids, and other compounds that impart onto cannabis the effects that people are looking for. And it's not just THC that people are looking for. I think many of you are aware of CBD and other cannabinoids that are active. But these are things that a lot of producers are interested in maximizing. They're looking at different strains and strains of their plants to make sure that they maximize either THC content or CBD content. But it's important to be able to test for this, and these are the solutions that we provide. But there are some serious challenges with growing cannabis. And for those of you who work in greenhouses and are aware, one of the three main challenges with growing cannabis are things like powdery mildew, formation of mold, or mites. And these are all challenges because any one of these three can destroy an entire crop you have. And this is a very expensive problem because if you have things like powdery mildew, you can destroy your entire crop of cannabis in a greenhouse, or mites. And mold has the challenges of producing aflatoxin, which is one of the most carcinogenic compounds known. And so mycotoxins like aflatoxins and ochratoxins are extremely carcinogenic, and these are produced by molds that can grow on the cannabis plant. And and this is actually, there was a case where a man in California, immunocompromised person, died after acquiring a fungal contamination that may have originated from smoking contaminated marijuana. So quality control is really important. The testing for things like mycotoxins is very important. And many of the products, Globe and Mail did a test, they found that many of the products that are currently sold in dispensaries, they fail the standards of safety looking for bacteria, yeast, and mold. And so the problems are compounded if people extract the cannabis and they extract it into an oil, because what happens is that when you make an oil, this concentrates contaminants like pesticides, mycotoxins, mold, and bacteria. And so to combat the problems of mold and powdery mildew, some licensed producers in the past used pesticides on their cannabis plant. And one of the pesticides that was used is myclobutanol. And myclobutanol is a compound, is a herbicide that you can buy off of Amazon. And so it's very easily accessible. And one of the problems that happened was that when myclobutanol was found by a chemical analysis, there was a massive recall of these products. And the reason is that myclobutanol, if it's smoked, that byproduct is hydrogen cyanide, okay? And so the smoking of this weed that is contaminated with myclobutanol caused a lot of lung damage and respiratory damage in people who consumed this. And the consequence of this was that there's a very large class action lawsuit now against some of these growers because they used myclobutanol in their product, all right? So as you can see here, products like Eagle 20 can easily be purchased off of Amazon. It contains, by weight, 20% myclobutanol. And so oftentimes the people who work in the greenhouses, they have to evaluate, you know, do we lose a product? Do we lose our crop because of powdery mildew, mold, or do we spray it with myclobutanol? And because of this, Health Canada has now announced regulatory guidelines where they will start randomly testing licensed producers. And so the consequences are very serious. You know, not only are there class action lawsuits, litigation that can occur, but also there are large fines that can be levied now against producers and testers that are using banned pesticides in their products of up to $1 million. And there are other regulatory enforcements available that can have very serious consequences. So the incentives for companies that do it correctly, that do it for testing, is that the next really big market opportunity is in the lab testing. So if you provide a very specialized lab testing services for the licensed producers, they have to test their products. And they can't just simply send it off to any lab. They have to send it off to an accredited lab that is an accredited licensed dealer lab in Canada. And so Health Canada has set up 2 licensing streams. One is a licensed producer that can grow, is licensed to grow cannabis, but they cannot test for pesticides. So a grower cannot test their own products for pesticides because of conflict of interest. They must send it off to a licensed dealer. And licensed dealers are the laboratories that can test for pesticides, and they report back to the licensed producers, and then the licensed producers then report to Health Canada if they find any of these banned 95 pesticides. And so there's a guideline that was released about mandatory testing of pesticides in cannabis products. There are currently 95 pesticides with reporting limits that must be met. Anything that is found at the reporting limit is reported to Health Canada. Okay? And none of these 95 pesticides are allowable in any of the cannabis products. And the document outlines the technologies and the techniques used to do the testing to make sure that the products that are sold to the public are safe to consume. Okay? And so here I've shown you, for example, myclobutanol, the compound that I mentioned earlier. The myclobutanol has to be detected at levels down to 10 to 20 parts per billion. And part per billion is simply a fraction. And it literally is 1 over a billion. So it's like part per thousand is like, imagine 1 gram over 1,000 grams. So a concentration of a part per billion is 1 over a billion. And to understand the level of what this means, to put into context, this is literally a fraction that equals, in a part per billion, 3 seconds per century, measuring 3 seconds per century. Or in a part per trillion, which we do routinely, we measure down to a fraction that is equivalent to 3 seconds per 100,000 years. And these are the levels that we are able to measure to and able to report to. And that is also equivalent to 1 part per billion is equivalent to half a sugar cube dissolved in an Olympic-sized swimming pool. Okay? So that are the levels that people have to report down to and measure down to. And there's a very, very tiny, very, very small amounts. And so the skill levels and the analytical testing power to get down to these levels are quite amazing. And so this is some data that we have from Agilent Instruments and many of the licensed dealers that we deal with. We can measure down to 100 times lower than Health Canada reporting limits. And this just shows you the calibration. We can quantitate exactly how much myclobutanol there is within either an oil, leaf, flower product. And this is typical of a large Agilent customer. All the white boxes are Agilent Instruments. And the value proposition is that we make very robust, reliable instruments. We are the market leader in this. And we have been supplying routine labs, clinical labs, research labs all over the world. And the value proposition is that if you are a licensed producer, you need fast, accurate turnaround time for analysis. And licensed producers don't have time to sit on inventory with product expiration times. And so turnaround time for test and analysis is very, very important. And so that's just a little bit of what we do as Agilent Technologies. If you have any questions, we have a booth back there. Many of you have come by. If you have any specific questions, I'm very happy to engage you at the booth. All right?